the objectives. So the objectives are what typhoid fever is, history and transmission, symptoms, location, who it affects, how the bacteria travels inside the body, prevention, treatment, diagnosis, and then future research. What typhoid fever is? Typhoid fever is a disease caused by the bacteria Salmonella typhi, and it's spread through food and water that is contaminated with the bacteria, and it's mainly common inside developing countries. And most Salmonella bacteria, they affect humans and animals, but Salmonella typhi only affects humans. And if it goes untreated, it can be fatal. And so this is a picture of the bacterium Salmonella typhi. Transmission. Typhoid fever spreads by eating food or drinking water that's contaminated with the bacteria. And if someone eats or drinks a small amount of something with infected feces or urine, they can contract the disease. So these are the steps of how you can contract it. So an individual has a bowel movement or they urinate, and after that, they do not wash their hands, and then they begin to prepare food. And then that food is consumed by someone else. Or another way to contract the disease is to consume water that's been contaminated, and the water can be contaminated by poor sewage. This is a flow chart that shows it. So first, the person has a bowel movement where they urinate, and then after that, there's no hand washing. Then the person prepares food, and they give that food to someone else. From them not washing their hands, the feces is still on their finger, and then they give it to someone else. History. So a very popular case of typhoid fever was by Mary Mallon, and she was the first American to be a healthy carrier, and she was asymptomatic, which means though she showed known symptoms, she still had the disease and she was still spreading it around. Throughout her career as a cook, which lasted between 1900 and 1907, she infected about 50 people, and later 3 of those 50 people died. And in the summer of 1906, she worked for a family as a cook, and she infected 6 of the 11 people inside the house through cooking. And then in 1907, she was taken to a hospital, and she was diagnosed with typhoid fever, and then she was put into isolation and released in 1910. And then this is a poster that was put in around New York in 1909 to inform people about Mary Mallon. And in the poster, it shows that she's putting skulls inside the food, represents that she's putting death inside of it. Typhoid fever used to be a very common disease inside America. In the 1880s, for every 100,000 people, 150 of them were infected with the disease. In 1898, that was the Spanish-American War. 20,936 soldiers out of 150,000 soldiers were infected. And in 1919, in America, there were about 15 cases reported that year. Typhoid fever today. Today, there are about 16 million cases worldwide. And from that number, there are about 300,000 deaths. And then there are about 400 cases reported every year in America. And that number mainly comes from people that travel to areas with a risk factor of getting the disease and bring it back with them when they travel back to America. Discovery. Typhoid fever was discovered by Carl Joseph Edworth, and he was a German bacteriologist, and he discovered typhoid fever inside 1880. And this is a picture of Carl Joseph Edworth. Symptoms. Symptoms appear over a 4-week period. By the 4th week, symptoms start to improve and you start feeling better. And so once symptoms appear non-evident or they don't show anymore, you still may be carrying the bacteria. Week 1 of symptoms. So when signs and symptoms do appear, you may experience a fever, and the fever starts low, but daily the fever starts to increase. And it can usually get as high as 103 or 104 degrees. You also may get a headache, weakness, dry cough, loss of appetite, abdominal pain, diarrhea, constipation, or you may get a rash. And the rash is flat and rose-colored, and it usually appears on the chest and the abdomen. Week 2 is symptoms. If the disease still goes not treated, you may enter stage 2, and in stage 2, you may you can still have a high fever, you have diarrhea and severe constipation, you have a reasonably large amount of weight loss, and you have an extremely swollen abdomen. Week 3 of symptoms. By the 3rd week of symptoms, you may become delirious, and during this time, you start to develop complications that are life-threatening. Week 4 of symptoms. In the 4th week, this is where you start to see improvement in your symptoms. And in week 4, you gradually start, your temperature goes back to normal from the fever, and this usually may take 9 to 10 days. And then even though your fever is gone, you can still have symptoms for up to 2 weeks. Complications. Okay. Complications include intestinal hemorrhage, which is the bleeding of the intestines, or intestinal perforation, which is holes in the intestine, or kidney failure. And 1 in 10 people have complications, and they usually start the 3rd week of having symptoms. Where typhoid fever is commonly found. It's mainly found in third world countries like China, India, Indonesia, Vietnam, Africa, Asia, and South America. And this is because they have a limited access to clean water. Washing hands is less frequent. Healthcare is not very common. They have a poor level of sanitation, and they have a high population density. So inside this map, it shows that it's common inside India as a continent, Asia, Africa, the Caribbean, South America, and then Central America. Who it affects. Typhoid fever mainly affects children and younger adults, but mainly children, and the average age for children is 5 years of age, and this is because their immune system is still in the process of developing. How the bacteria travels in the body. So typhoid fever is a disease that once inside the body, it spreads to other parts. So first, once you have infection inside of you, it goes to the lymphatic glands, and then it travels to the lymph glands, and the lymph glands are filtering stations along a chain of lymph drain fluids, and then it gets into the bloodstream. And after that, it goes to the liver, and during this time, it's common to have bronchitis because the lungs are inflamed. Bronchitis is the inflammation of lining of your bronchial tubes. This is a flowchart that shows how it spreads in your body. So first, someone eats food, and then it goes to the lymphatic glands, then it goes to the lymph glands, and then it goes to the bloodstream and liver. And once it gets to the liver, that's where it becomes very serious, because once in the liver, it can go to many different parts of the body. Diagnosis. A common way to see if you have the disease is through blood cultures. Blood cultures are a laboratory test to see if bacteria is inside a patient's blood. Prevention. When living in close contact with someone that may have a disease, they should first be tested for the illness, and if they do have it, they should not be allowed to cook for people and then give that food to someone else. When traveling, you should drink only bottled water or boil water for at least 10 minutes, and you should not buy water from vendors off the street because it may have the bacteria inside of it. Eat food when it's hot and make sure it's cooked thoroughly. Avoid eating any fruits or raw vegetables that cannot be peeled, and avoid eating raw shellfish and unpasteurized dairy products. And when eating seafood, it should be steamed or boiled for at least 10 minutes. Because sometimes seafood beds can be contaminated with sewage, and sewage can have the bacteria inside of it. Treatment. About 2% to 5% of patients become permanent carriers, and that means though they don't show any symptoms, they may still be carrying the disease, and they can still spread it. There are the vaccines have been around since the 1800s, and there are 2 vaccines. Except the vaccines only provide a limited amount of protection. And the vaccine is recommended to get if you're traveling outside the United States, Canada, Northern Europe, Australia, and New Zealand. Treatment. Treatments require antibiotics, but only if you get diagnosed inside the early stage. And there are 3 antibiotics, which are fluoroquinolones, chloramphenicol, anthrax, trimethoprim sulfate, methazole, And the type of antibiotic you get depends on where the infection is inside your body. And then when the case has gotten serious, you have to get them injected inside your bloodstream. And you'll be given electrolytes or fluids that will be given inside the vein. And electrolytes